As you all may understand, working with pediatric clients, including the care, is not an easy situation, which we all have to come across, especially in the care homes. So, caring for the children with medical needs or developmental disabilities in the home settings can be difficult. So, this module will focus on these situations along with practical examples with fundamentals of early development, strategies, how to promote the health through the quality caregiving relationships, the common conditions, and the situations requiring the children's home care. We will also try to discuss about the premature babies which are born early, due to which the caretaking starts in the hospital and then the transition to the home needing supplemental oxygen support, developmental milestone monitoring. In fact, the diagnosis of childhood disease or disability, for example, it may include like diagnosis of cancer, cystic fibrosis, or cerebral palsy onset during key formative years makes professional assistance bridging gaps in self care abilities and lifted burdens on family essential. The recovery after surgery or severe injury car incidents, near drowning events, acute appendix ruptures, etc., may necessitate hospitalization. In fact, the terminal illness palliative support, for example, for caring for a dying child, revolves around comfort. The parental challenges involving preventing care may include the single parents or the families who are dealing with the multiple chronic conditions, the work constraints requiring travel may spur the aid assistance. Infant or toddler, they may need cuddles, gentle care like the bathing, feeding, or diaper changes, engaging through play, music, and tactile toys to promote secure attachment. Similarly, for the preschoolers, as you would have noticed, they need to be encouraged for the interactive learning of shapes, letters, countings, and also the imaginary play fosters creativity. Similarly, for the school aged, it is different. It includes to assist maintaining classroom lessons through the continued activities using reinforcement, reading, coordination, and critical thinking despite disabilities that may set them apart from the other peers. For example, for the teens, fostering friendly conversations, combating stigma or embarrassment over visible medical devices or conditions, acknowledging maturity emerged alongside body changes are important. The patience and compassion helps to build trust to enable care, education, and empowers progress. In fact, coordination with the providers like the nurses, with the physical or occupational therapists are also important. Administering medications, monitoring for side effects, and notification of the parents or prescribers also needs proper usage. Similarly, providing assistance for toileting children or changing incontinence briefs, feeding tubes management, applying orthopedic braces are also important. The engaging the child tendencies with matching ability and mood during the daily aid through play, stories, music, crafts, and establishing nurturing connections despite surrounding medical fragility. So there are a lot of patients with cancer like leukemia, brain tumors, lymphoma, attacking critical development years, which need intense medical interventions. Similarly, for patients with cerebral palsy or cystic fibrosis, the respiratory lung or engine disorders fills airways with the thick mucus plugs. Infection risk is there for such patients. Then, for the epilepsy patients, monitoring of the seizures and taking care of the medications, or the prevention gears or tracking details are very important. Similarly, for the asthma patients, the coaching regarding proper usage of inhaler, the need to identify the signs needing for emergency intervention for the airway is important. So, some MCQ questions. For example, which task helps to foster infant cognitive, social, and motor development? The options are, as you can see on your screen, which one you think is the right answer? A, B, C, or D? Answer is C. The rationale, as you may notice on your screen as well, pediatric development thrives are important when the caregivers tend to engage. Question 2. A parent seems excessively worried about the minor child symptoms. What is the appropriate answer? The responses are there on your screen. So, which is the right answer? Right answer is C, because the compassion for caregiver anxiety over managing serious pediatric diagnosis, even during stable phases, promotes trust and upholding dignity better than dismissing struggles. Question 3 is in front of your screen. What is the right answer? Is it shape, or sing along, big bin of loose, or which, or D is it? So the right answer, as you could see, is B. The toddlers learn through sensory exploration. Now, coming to the next question for the quiz. Which personal care task for a disabled teen respects dignity? Is it A, B, C, or D? As you all will agree that caring for teens with inputs, preserving choice and transparency, not just hurrying through, isn't it? So now coming to the question number 5. It's on the screen. Which is the right answer? Is it A, B, C, or D? Choose your best option. Right answer is B. As you may understand that clearing space to prevent injury safely contains seizures until they pass, isn't it? So, next question, number 6. Which snack choice would you suggest? And what is the rationale as well for this? So we have to keep it in mind that lower simple sugar grains like, graham crackers offer longer lasting glucose releasing, avoiding blood sugar highs. So that's why the right answer is B. Next question. When soothing a crying infant, an aid should be? What is the right answer? If you want at any moment, feel free to pause the screen, take time to think about the logic, and then answer. As you can understand, distraction of the comfort items combined with gently holding or different maneuvers is very important. So now coming to the next question. Question 8. Very important situation. So a parent calls concerned a child's medical equipment is beeping. What would you do as an aide? A, B, C, D. And why do you think the answer is right? As you may understand, you need to first assess if the vital signs shows any emergent clinical distress before addressing the equipment itself. Okay? So now coming to the next situation, question number 9. As I have said it earlier as well, feel free to pause it at any moment if you feel it is too quick. Think about the rationale. Knowing the right answer is not just the most important thing, but knowing the right rationale is important. Okay? Now, coming to the last question, question 10. What do you think? Which is the right answer? And what is the rationale for this? As you all will agree that non-verbal pediatric pain assessment tracks observational markers like winces, moans, elevated respiratory rate, and flushed skin, etc. That's why it is important. So I hope you all will be able to understand that we have tried to highlight the key issues which can happen in the pediatric home healthcare, trying to balance the different issues to collaborate with the guardians and also the care coordinators. Thank you so much.